Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. We're going to be continuing on with the EMS Quick Study tips and resources here and the IV therapy section of this. This is sort of a larger section because a lot is involved when it comes to starting IVs. And while these are just key points, just imagine the depth you'd have to go into in a regular presentation about IV therapy, right? But what I want to, of course, mention, as I always do in the beginning of these quick study tips, is why is this important? You might be saying, Jim, I know all about IVs. I know the catheter sizes. I know how to start them. I'm comfortable getting IVs. That is great, and you should be, right? But it's important because, sometimes we forget the little nuances of what it is to start an IV. Maybe we forget the nomenclature of something, what something might be called, right? And by reviewing and doing these quick study tips, it can help us. So when we in front of an exam or we're documenting, right? I pushed out a lot about documentation, and we're pushing all this stuff. What happens? We don't want to use the slang that we use on the truck, right? We want to use the actual what it is, right? The verbiage of what it actually is that we're doing. And this makes the documentation much cleaner. It lets people who are not in EMS be able to read it and understand it, right? And it also helps you when it comes to exams, so that when you see a word that maybe you know what it is or you can't quite remember, but then you'll remember that, hey, that's something to do with IVs, or that's what that officially is called when starting IVs, right? And that allows you, when you're looking at a question, maybe the question isn't necessarily directly related to an IV access, but they throw a word in about IV access. If you're comfortable with the words and know what it means, it's not going to confuse you, right? It's not going to kind of be a sidebar that you're going to sort of like lose track and focus on, well, why did they put that word in there type thing, right? So it all ties in together, guys, right? It's not just about exam preparation, which I try to make these primarily for, so that if you see what I'm putting out here, and you're not quite sure what's happening, it'll motivate you to open up that big textbook, or to research it online, or maybe use a resource like turbomedic.com to go ahead and research more and find out what it is that I'm talking about, right? So these are key elements, and a lot of times you will see these types of wording and the verbiage and questions about what I'm talking about on exams, which is why I focus on it. So today we're doing, again, part 2 of IV therapy, and we're going to focus today on the needles and the catheters. We're going to talk about the gauges, right, and measurements, and we're going to talk about HEP locks, right, or IV locks, okay? And again, don't run away just yet. I know a lot of you out there ready to hit that stop button and start looking at something else than kittens or something like that on YouTube. Don't leave me just yet, guys, okay? Again, I know that most of us, if you've been in the field for a little while, you know all this, right? This is like second nature to you, right? And I'm aware that when I'm going through this, that some of this might be second nature to you. Don't blow it off. Follow me through. Watch all these episodes, so if there is something that you're missing or something you're not comfortable with, you can go ahead and just kind of brush up on it, right? All right, so let's get into it real quick. Let's talk about the needle and the catheter. And we all know the needle, that's what we stick the patient with, right? That's what's going to facilitate the catheter get into the vein, all right? And then, of course, when we're done and we withdraw the needle, the catheter stays inside the vein, and that gives us the access to give the patient fluid or medications, or just get IV access using something like I'm going to talk about, like a HEP lock, or the IV lock, right? There's 3 types, okay? And it depends upon where you are. A lot of us, nowadays we've got the needleless systems, and by now you should be using some sort of a needleless system when you're starting IVs, right? I don't know personally of any agency who's not using a needleless system, but I could be wrong, right? There might be people still out there who are in the Stone Ages. But it's a plastic, okay, hollow type needle, right? Or metal type needle. It's pulled out after you insert it into the vein, and it leaves that catheter in place, right? So the the cover, the plastic cover over that needle. Okay, and your measurements normally 14 to 26 gauge needle is what we're looking at. But in the field, you're gonna probably stop about 24. No, that's 22, and those are for 22s and 24s are for pediatric patients, or for those really brittle diabetic patients or patients that you really have a hard time getting IV access. You might go with a 22 gauge, right? And the plastic, you have the plastic catheter, which goes through a hollow needle, which is another type of IV, okay, sort of needle catheter combo. And then you have the hollow needle itself, which is, there's no catheter, it's just a hollow needle, which is that butterfly, right? In EMS, we don't really use butterflies that much, okay? We don't really draw blood like that out in the field, okay? So for us, when it comes to butterflies, we're not really going to see it. You might be and I've seen them on ambulances and where you might see a butterfly needle for pediatric patients and something like that, right? But normally that hollow needle butterfly is normally you'll see that for phlebotomists and stuff like that when they start IVs. Okay, so these are the usual common three types. For us, the first one is the one that we use mainly out in the field. Okay. All right, is that plastic cannula, that plastic catheter over the hollow needle, and then where the needle is pulled out. But again, we're not really pulling that needle out anymore. It's the needle system where it's maybe a spring loaded, or maybe you advance the hub of the catheter, the needle catheter, which advances in, then the needle will retract. All right, all different types of different needles out there right now, and catheter, the needle catheter combination, which makes it needleless. But the overall idea is that the catheter is that plastic catheter that's over that hollow needle. Okay, and the needle comes out after you get into the vein. Okay, gauges, again, I mentioned before. All right, the measurements usually 14 to 26. For EMS, we usually stop at 24. Right? I don't think I've ever used a 24 gauge needle myself, but I'm sure there are times when that has happened. Again, mainly for pediatric patients. Nowadays, when you start IVs on patients, especially pediatrics, a lot of times you're going with the IO, right? And you're not really worried about that 22 or 24 gauge if you got to get IV access on a pediatric patient. Okay, but no, this is just general knowledge type stuff. Again, key elements you're going to see on exam when they ask you the ranges of gauge measurements. Okay. Now, this one thing that might be easy for you to recall is that the smaller the gauge measurement, like a 14, the larger the bore, the larger the needle. Okay, the wider it is for fluid and medication to get through. Okay, normally you're going to use those larger gauges, those 14, 16 gauges for patients that are in trauma, type shock, maybe cardiac arrest. Patients that need a lot of fluid. You'll go with the larger gauge. But again, you're going to, of course, base that on the patient, a patient history, what type of IV access do you see. While veins are somewhat elastic, you don't want to try to start a 14 gauge needle into a pediatric vein, right? So just keep that in mind. All right? But just so you know, the larger gauges are for the patients who are more often in shock and trauma and need fluid and stuff like that. So just keep that in mind when you see that on exams, okay? And again, guys, I know you probably know a lot of what I'm speaking about. You know this stuff already, okay? About the bore sizes and all that good stuff, and the large of patients that are trauma patients, right? Just bear with me, stick with this, just in case there's something that's a key element of IV therapy that you don't necessarily want to miss. Okay, you don't want to necessarily miss a specific area, okay, of IV therapy. Okay, all right. So let's get on with this now and talk about the intermittent infusion device. Well, this is known as that saline lock or the HEP lock. In EMS, there was a time when we used heparin, those HEP locks, because they use it in the emergency room. Nowadays, most EMS systems will just use a saline lock. Most ERs just start off with a saline lock, okay? And that's usually what you're going to see. And this is that short tubing. If you're not familiar with it, it's usually just that short little tubing, okay? And it has a clamp on it, okay? So you don't get any backflow of the into the tubing. It's got a medication port on it and a connector that you can connect, let's say a larger amount of fluid. Okay, so you start the IV. You got the med port. You're gonna flush it with your, with saline or heparin. Okay, and then a connector which goes right into the hub of where you start the IV. Okay, and this is for patients who you just need to get IV access. Maybe you're anticipating giving medication. Maybe you're anticipating giving fluid or sort of a just in case type thing, right? So that's what you're going to usually use saline locks for. Now, just real quick, I want to go over sort of like the anatomy of a saline lock, and this is also commonly known as an IV start pack, right? What do you usually find in this? Well, you got your IV cannula. Normally, it'll be maybe an 18 gauge or a 20 gauge in there to start off with, or maybe a 16 gauge, right? Usually one or two syringes with heparin or saline. Normally, again, saline. Nowadays, you'll be usually a 5 or a 10 cc syringe. Okay, it all depends upon where you are. Okay, I try to general here and say 3 milliliter syringes because I'm not sure where you're working, what you're supplied with. You're going to have the device itself, which is that tubing that we just spoke about, and you're going to have tape or some sort of securing device to secure the IV down, right? Maybe you're doing the whole, old school sort of tape down the IV. Maybe you've got that vena guard going on there. Okay, whatever the case may be. Now you might also have some blood drawing equipment there as well, depending upon your system and whether or not they require you to draw blood. I've worked places that had different blood drawing equipment for different hospitals that we would transport to, because some hospitals wanted certain tops of blood tubes, other hospitals wanted other ones, some trauma wanted certain ones, and then others do not let you draw blood at all. So it depends upon where you work. So I'm adding this in here so that if, the type of thing you should consider, if you are the type of person who likes to be prepared and have everything set up already, go ahead and you might want to go ahead and put your blood drawing equipment included in the IV start pack. And of course, you're going to have your antiseptic swabs as well, whether it's betadine or you're going to have your alcohol, the iodine, whatever the case is, whatever you use to cleanse the site and cleanse med ports and stuff like that. Okay, and that is pretty much it. Again, this is very basic, and I know a lot of you may be rolling your eyes and saying, "Oh my God, Jimmy, I know all about IV catheters and saline locks," and that's great. I hope you do. I hope this was very, very rudimentary for you, and that maybe you don't need this content. I have to include it because it's part of the overall quick study tips, and it flows in steps, so I don't want to leave it out for maybe that one or two people out there who are not sure, they're just getting into EMS and they're not quite sure how this stuff works, and they want to kind of remember it for an exam, right? I want to try to help them out too. So if you're the person that's really advanced, you know this stuff, that's great, and I appreciate you watching these videos. But at the same time, keep in mind, somebody out there is new, right? They're just getting into EMS. They need this sort of help. They need these little key kind of factors to help them on exams, to stuff that they can think about when they're treating a patient, they're documenting on a patient, right? So that's why it might be basic for some, but for others, it's really, it's exciting for them. They're just getting into this stuff. And I hope that I'm helping them with that excitement and helping them, keeping them focused and keeping them, excited about what they're learning. Okay, even if it's sort of, reinforcing what they just learned in class. Okay, so next time We're going to talk about vein structures, okay? And we're going to talk about IV site locations. And I'm excited about this one next time, guys, because when it comes to IV site locations, a lot of us think about, oh, you're going to put in the hand, you're going to put in the AC. No, but there's a lot more areas that you can start an IV if you need to. And of course, that's going to depend upon your protocols and what your guidelines, what you're allowed to do. But there are many other sites you can start an IV in besides the hand or the wrist or the antecubital. So next time we're gonna go over the vein structures, but we're going to really go over a lot of the IV site locations. Okay, so excited about that. So we'll see you next time with that. I hope you can use these Monday minutes, guys. I know, like I said, sometimes it's very basic, but they're the things that I hope that if you see something that you're not quite clear on, maybe it's confused in the way that I'm presenting it, or maybe you just need to go and reinforce it a little bit, it'll get you to go and open up your review book, open up that big textbook, review the things that you feel you're weak on. This is going to help you when you take that test, when you document, when you interface with other medical professionals. Okay, guys, a lot of the stuff that I get for these Monday minutes, these quick study help here is from the EMS Quick Study Guide. Really, guys, this is the meat and potatoes of an EMS course, right? It kind of breaks down that big textbook into about 100 or so pages. Go check this out. This is something that I use on a regular basis. This is something I encourage people that I coach that are struggling with exams, that are struggling in the EMT or paramedic classes. I tell them to turn to this. This is something that I encourage them to use to go ahead and get them on a track. I give them a little formula on how they can study and get prepared for exams. Okay, so I believe in this guide. Go check it out. I think you'd be well worth it for you to add this to your EMS library. So click here for details and find out some more. Hopefully you'll claim a copy for yourself. All right, guys, that's it. As always, if you've got some minutes of your own and you want to break away from these quick study tips, that's great. I'd love to do that too. Send me an email. Let me know. My email address is contact@emsofficehours.com. And don't forget, guys, follow me on Instagram and on Twitter. Both of those, my screen name is EMS Safe. So I'm at EMS Safe at Instagram and Twitter. Go check me out and follow me on both of those as well. All right, guys, that's it for me. Until next time, as always, I am Jim Hoffman for EMS Office Hours on the Monday Minutes. Stay safe.